So if you are very far from somebody, then the chances of you getting the infection is really minimal. So that's one understanding. The other understanding is that the droplets may be on hard surfaces that you may touch. So as you touch, you may touch your eyes, your nose, or your mouth. It may get infection. So in that context, we preach hand washing with soap and running water. So that is the basis for that other intervention. But then there are instances that you may not be able to maintain that required social distance, or what we call the physical distance. So you need to have a blockage. And blockage comes to the use of the face mask, or what we call face covering. And it's very, very important. But the idea is that you are trying to prevent the virus from getting into the mucosa of any part of the body that may get the infection. So you try to prevent your nose, your mouth from the virus from getting into you. So what best can you use? And that's how this idea of a face mask comes in. So the indication is the use of face mask. But then there are instances that maybe you may not be able to use the face mask. And let me be clear. I'm reading from the CDC recommendations. And what he's saying is that it's indicated that face shield is indicated when persons with hearing impairment, or those who care for or interact with a person who is hearing impaired, they may be unable to wear cloth face covering if they rely on lip reading. As we speak now, the gentleman on the left, early stages of this outbreak, you could see they were virtually very nothing. And there was a lot of complaint that why are we preaching face masks and they are not wearing it? It's because we do lip reading. So in that case, you cannot cover the lips and say that you can communicate to someone with hearing impairment. So that is the only indication whereby you can say that I'm now going to use face shield. But for the purpose of addressing the challenge of the infection, the first point of call is the face mask. And I think that we want to employ all Ghanaians that let's use the face mask, because that's the surest way that you can actually prevent yourself from getting infection. If you wear the face mask, the face shield, then it must be on top of a mask. But it should not be an alternative to the use of a face mask. And I want to assure all Ghanaians that it's not for convenience that we are replacing a face shield with a face mask, but the purpose of preventing infection. Thank you very much.
Thank you. Simple and straight point. And if I may reiterate, there's a foundation reason for which the face shield may be used when dealing with persons with hearing impairments, etc., so that when you are, for example, doing sign language, etc., those who do lip reading and those who do the sign language gesticulation as part of the exercise, they are encouraged to use face shields. Ordinarily, if you use a face shield, it must be in addition to the mask. It is not a substitute to the mask. It is a complement, not a substitute. And so we want to encourage the general public so to do. Particularly our colleagues who have some of the major mass media outlets, who have guests on your television stations. What you do, a lot of people will also learn from. So we encourage you that you also do the right thing, so a lot of people can also learn from it. Colleagues, our final brief this morning has to do with safety in schools. The Ghana Education Service and the Ghana Health Service last night released a statement following the testing on the campus of the Accra Girls High School. This morning, the Ghana Education Service Director, Professor Kwesi Opoku Amankwa, is here with us this morning. He will give us an update on that and then speak generally to the subject of safety in schools. We need to ensure that parents and students have a lot of information so that anxieties are reduced. So, Prof, I would invite you to the podium. Prof was telling me earlier this morning about his COVID status and what he is doing to help us fight stigma. So maybe he will open up with a few comments on that.
Good morning. Thank you, Honorable Minister. I guess you've been working hard with the health professionals. You now almost think health. Yeah. Honorable Minister, the President directed schools should be opened. And first set of reopened was the tertiary institutions. This was followed by the primary institution.
JoyNews. Now, we just came back from the Information Ministry. I have to apologize that we had a slight challenge with our connection there. We will go back immediately. We have established a more stable one. But here are the updates on what we learned when we went there. First of all, 3,716 active cases. It's the lowest active case number since we saw that spike we changed our discharge protocol in Ghana. Our number of active cases went up by 1,500 between the 21st of June and about the 2nd of July. It's been going down steadily, slowly since that time. However, the key issue is what's being addressed right now, which we will be taking you to very, very shortly. Professor Opoku-Amankwa, he is the Director General for the Ghana Education Service. He's speaking to the fact that out of 314 persons who were tested in Accra Girls Senior High School here in Accra, 55 of them tested positive and 259 of them tested negative. Now, it's important that we look at this figure because it was 6 just a couple of weeks ago when initially some cases were recorded. There were 6 students and a teacher and a spouse, so that makes 8 people in total. Before yesterday's release came out, a total of 14 students had tested positive in schools across the country, some in Wesley Girls High School allegedly, some in the Fansfilm School allegedly, and a number in these schools that we know. Odogono Senior High School, for instance, had some, we can confirm that Odogono Senior High School had some cases. Kumasi Wesley College had some cases. Now, the question that it has raised on social media really has been about whether or not we should close down schools after this. Joy FM had a poll on Twitter. I'm reading it for you right now. Very, very split views, I must say, because out of 2,226 people who have voted, 39.4% of the public are saying that they should stay in school. The students should not be asked to go home. 37.6% say they should be recalled. And look at a whopping 23% of the voters are sitting on the fence. They say it's a tough call to make. Why is this important? State officials have been repeating that in the first place, students may be infected and we would not know. So if students are infected in these senior high schools, they may carry these infections home. That, of course, is not the case in Accra Girls Senior High School, where we know for sure that 55 people have tested positive. So it will be interesting to see the steps that the Ghana Education Service is taking. I'll take you through a few of them now. They've identified and they've segregated these 55 persons who have tested positive. There's a sample collection and laboratory testing of all contacts identified and suspected cases. All confirmed cases have been transferred to designated national treatment and isolation centers for management. There's a restriction of students that attend dining at a particular time. The question here, of course, is why are the students being restricted now? Because we understand that when the president was giving his 12th address to the nation, he made the case very clear that students are going to adhere to strict social distancing protocols in public gatherings. In fact, some public gatherings were closed down in the first place, in the first place. So there was no assembly, there's no sporting activities. The question here is that why are we now limiting dining hall attendance? But of course, these are questions that we're going to go through the rest of the day, and we will soon be taking you back to that news conference for Professor Opoku-Amankwa to answer a few more of those. There's also enforcement of social distancing protocols, enhanced hand hygiene practices, and the proper use of face mask. Disinfection of the entire school has been carried out. Adequate personal protective equipment, PPEs, have been provided to health staff stationed in the school. Now, there's also education on COVID-19 prevention and control, which has been intensified again within the school. Now, counseling and psychological support is being provided to the students. The school has designated a quarantine, an isolation center. Parents and guardians of affected students have been duly contacted. Staff of the school have been reassured. Now, a few other schools, the statement says, have reported sporadic cases which have not experienced a surge. Now, to prevent the spread of COVID-19 in senior high schools across the country, similar measures are being implemented. It will be important to know which specific measures are being implemented in schools which may not see the large number of cases that Accra Girls has seen, but may have cases. Now, of course, the key thing here is that 314 people were tested in Accra Girls, and 55 of them, nearly a fifth of them, which is nearly 20% of the number of people who were tested, actually tested positive. What does that mean for the positivity rate of that area? Are we then to, what do the health experts say? Should we then extend this positivity rate to all other schools across the country and assume that this is the number of people who will be positive in all of these areas? Or is it a stretch? Of course, there is a positivity rate for the country, the number of people who are being tested totally, and the number of positive tests that we are seeing in those samples. So we'll do a bit more analysis of the numbers from Accra Girls and do a bit more analysis of the steps that government is taking. And we'll take you back to that news conference being held by the Information Ministry. Stay with us. This is News Desk. We'll be right back.